Hello everyone and welcome to this channel, Talk with Dr. Chini. I'm so glad to have you here. Today we're going to be talking about the big elephant in the room, coronavirus 2019, also known as COVID-19. Unless you've been living in a bubble, you would have heard coronavirus before now. You would have heard about it. Just because of this is the virus that just started with being present in China and now is gone around the world, and the rate at which it's spreading is increasing at a rapid rate that people are really panicking all over the world. So I want to talk about it like in regards to moms, in regards to pregnant women. So this topic is just coronavirus in breastfeeding and in pregnant and breastfeeding women. So for me, I was meant to be going to the UN. I was meant to go for United Nations Women's Conference in New York early, actually, I was meant to still be there by now. But because of the coronavirus and the rate at which it was spreading, it was cancelled. So I stayed back because I also have a newborn, which is my baby, and I was meant to be traveling with him. So in regards to moms, coronavirus is this virus that just started and is spreading. It can be, your neighbor can catch it and you wouldn't know. They wouldn't really look it. It's not pasted on the forehead. People that you pass on the street could have it and you wouldn't know. Someone that is with you in the same house could have it. So yes, in some countries is very prevalent at the moment, and whereas in other countries is not. I stay in UK, and at this moment there is a lot of cases, and we've had at least 2 deaths at the moment from coronavirus. The numbers are increasing. So many countries have shut down their borders. People are no longer allowed to come in or leave the country whatsoever. So even at this moment, to buy the necessary things in the stores, it's very hard because many things are out of stock. People are kind of hoarding things, buying things, and just feeling that we're going to kind of be in isolation for a long period of time. For me at the moment, I've limited my outings. My toddler that goes to nursery this week, I'm not sending her to nursery. My husband that is still working in the hospital, he has to be extra cautious because as a healthcare practitioner, you can't abandon the system. You have to, that's part of the oath. So bringing it back, the reason why it's important that you know what to do, I know what to do, is so that we would not choke the healthcare system. Like at this moment in Italy, the healthcare professionals are dying. Like a huge number of them have died out because of coronavirus. Because the reason is, when so many people are infected with it, is a disease that needs supportive treatment. So many people have to be intubated, and when you count the number of ICUs in around the country, it's not enough to sustain and keep even a 25% of the population in it. So if there happens to be an outbreak that requires so many people to be treated in intensive care units, that means a lot of people would not get the slot. So at that rate, doctors will start picking who is, when you kind of have to ration people, who would be given the bed, who would be intubated, who would be given a bed and just be managed conservatively before any other intervention. So these are the things that will make the healthcare system to choke up, and then it will just be catastrophic. So the best thing is just to manage it in a way that it would not overwhelm the healthcare system. Okay, so that's why you need to know, and that's why I need to know. So starting off with pregnant women. If a pregnant woman, I know this is actually something that many women are worried about, being pregnant, you feel like you're going to be exposed, you feel like you're going to just catch it the moment somebody within your neighborhood has it or something. But there has not been any study showing that a pregnant woman is more at risk at having it. Nothing has come up in that sort. So it keeps the pregnant woman within the normal, not like an elderly person. Okay, what you can do as a pregnant woman is to be extra cautious. Means you always have to be sure you're washing your hand. You are washing your hands. So this virus, if we're to take it a little bit back, let's deviate, is to just say how people are getting it. So someone sneezes, they release the viral particles. The particles can drop on surfaces, they can drop on clothes, they can just be in the air, that the person sneezed and then it just fell on you, that you're just somewhere maybe close to the person and it fell on you. So, and somehow either you just inhaled it, or you touched somewhere and somehow it got into your system. And then when it gets into your system, it's going to go through an incubation period, which is about, let's say, 4 to 14 days, and sometimes even 24 days. You may not be symptomatic, you may start showing symptoms. And then when people start showing symptoms, we're seeing fever, we're seeing cough and the likes. So that person now that sneezed, or that person that sneezed and it reached out, or maybe it sneezed on their clothes, if you as a pregnant woman comes in contact with that cloth, because studies have, like, there's a new study that showed that the particles on surfaces can actually last for 72 hours. So you don't know who has been there, who has sneezed there, who has done anything, whether it's on their clothes. People sneeze, like, people are told to sneeze into their elbow, right? But many of them are not washing their clothes. Like I was watching today and I saw a guy with he wore a suit and he sneezed like this. So that guy, is he going to wash that suit? Many people don't wash their suit after everywhere. So is he going to wash that suit? He might just hang it up, wear it again. So my point is that this virus is not like somebody sneezes and it's gone. You may not see the person sneeze, but just by mere interaction of the surface, by mere interaction of the person's clothes, the thing might just be on your own clothes and you carried it, and it might not get to you immediately, but because that virus is shown to be living and still be infectious for 72 hours, that means we all have huge chances of getting this virus. So at every point in time, you should consciously maintain the hygiene. And what does that mean? Like, you wash your hand for at least 20 seconds. Like, you have to count, you have to count, you have to wash all corners. You have to wash. If you're not able to wash with your soap, you have to get like a hand sanitizer. Just make sure it has at least over 65% of alcohol in it, at least over 60. Let's just say at least over 60 of alcohol in it. So, and you use it, on that. You don't need to wear a mask. Like, mask is scarce. The medical practitioners that are meant to be preventing this from spreading, like, they don't even have enough masks anymore. They are using one to see multiple patients, which is not right, which is also putting themselves at risk. So you only get a mask if you are suspecting that you have coronavirus or you've been confirmed to have one. Okay, so please, let's not just hoard the masks, because the people that need it actually need it to be able to help all of us, not just for themselves. Okay, so you understand why you should, as a pregnant woman, you touch, even when you feel like you did not touch, just be obsessed with washing your hands now. For this time period, just be obsessed with washing your hand. So having said that, if you don't have any real reason to be out, stay indoor, especially in countries where the numbers has increased, like in UK. Like, people in Africa, like, it's still very minimal, except South Africa at the moment. So if you're in place where a lot of people have been, like, the numbers have increased, stay indoor, minimize social outing. Like, don't be going out except when needed. Okay, distance yourself. Distance yourself when you're out. People are crowding into stores, and you find that a lot of people are coming together with little or no distance among themselves. Please don't be there. Distance yourself, because that's one of the key to reduce this spread. Minimize gathering. Stay home as much as possible. Stay home as much as possible. Isolate yourself. Let things just settle. And if you have to go for your antenatal, or if you have to go for your appointment, you can go, but just make sure that you constantly, your hands, that you're washing. If you touch your face, you are constantly making sure you're not spreading anything that from your hand to yourself. Okay, and keep a distance. If you have an appointment and you need to go, please, because during pregnancy we have our antenatals, we have some people that might be going for their sugar testing, we have different things that we have to go to the hospital. So contact your midwife or your hospital, and if all is in order, then show up. But always make sure you maintain your hygiene. So in an instance now that a pregnant woman is suspected to have COVID-19, or she has tested positive for it, the thing, like, studies have not shown us anywhere that is transmitted. Studies have not shown us anywhere that is transmitted. There is a Chinese study that has just confirmed that mothers that have tested positive for COVID-19, their babies end up having distress in labor. There's an increased risk of distress in labor. That's just all that we have gotten so far from the Chinese women's experience. So aside from that, if you're positive, you should not worry, but make sure that when it's time, make sure you're under constant monitoring by your healthcare professionals, that they know and they're monitoring you, and when it's time for you to have your baby, they will be the one, handling your birth. Okay, then if during that period that you've tested positive, you had your baby, after you've had your baby, of course your baby will be tested. And there is no reason to separate you from your baby. You and your baby would be together. Your baby will be tested, but there's no reason to separate you. You may be given a max. You should be given a max, but you should have your baby close to you. So the mask is for you to wear to prevent any viral particles, if you're to sneeze, if you're to, and all that. So you will not infect your newborn, but your child will be tested. So that's after birth. You don't need to be separated from your baby. And this progresses for women that are breastfeeding. So if a mom that is nursing, or a mom that is nursing has been suspected to have COVID-19, or she has tested positive for COVID-19, or a newborn or a baby that the mom is nursing has been suspected or tested positive, there is absolutely no reason to separate mom and baby. There is absolutely no reason. So this is the same thing that happens with all other viruses. Our body can produce immune factors that will help our baby. If your baby is positive, as long as your baby is sucking, like, there is no need to even separate, because the two of you being in the same place, except a mom that already had this before her baby is born. But for a mom that has just been nursing her baby, and then somehow either one or the other was suspected or confirmed, that means the other person also has it, just that they may not show the symptom, because, like I said, the incubation is already, the incubation period is 4 to 14 days. So it's already in the person. There is absolutely no need to separate a mom from nursing her baby because of COVID-19. It's only if the mom is very weak and she feels she does not want to nurse her baby, that is the mom's decision. But as far as the virus is concerned, there is no need to cause this separation, because if the mom has it, her body is going to be producing immune factors. If the baby has it, as the baby is sucking, the mom's body is going to get the memo and be producing immune factors that will all be going into the breast milk, and this will help the baby recover. This will help the baby get better faster. So there is no reason to separate. As a nursing mom that is infected, what I will advise you to do as well, or like I said for the pregnant mom, make sure you're not passing anything from yourself, from the surfaces that you've exposed any viral particle to your baby. Make sure there is no transmission whatsoever by being obsessed. Like, I need you to be obsessed with washing your hand. Wash for at least 20 seconds plus. Like, don't wash for less. Wash, scrub. Or like I said, use a hand sanitizer. I know like so many places are out of stock for sanitizers, so that's why it's important to just wash. Use soap and wash for that 20 seconds. So before you pick up your baby, wash. Get that germ off your hand. After you've finished nursing and put your baby down, wash. Just be obsessed. Wash and wash. Okay. And like when you're dealing with your baby, make sure you have your mask on. If your baby is coming close to you, have your mask, especially for moms that already have it and the baby does not have it. Put on the mask. So that you reduce the spread. Aside from that, nurse your baby because that will help your baby. I hope I've been able to deal with all the points that will help you during this period. Like for me, even with my toddler, because sometimes people that you stay in the home with may contract it. So that's why for my toddler now, we're keeping her home. So, and my husband that is a doctor, anytime he comes, he has to wash, he has to strip it all off before touching any one of us. Okay, so this is just to limit the spread. This is just to help contain the sickness so that it's just not going at this rapid rate, and limiting our social outing. Like all parties, like there's really no need for any big party at this point. There's really no need for conferences that will bring crowds of people together. Many things should just be diverted to other means of communication and avoiding personal communication. And as well, like for us, like for the milk booster that produces products, so our whole staff have been informed on this. So extra precaution, everybody is washing more frequently than before. So I need you all to just continue. No panic. Make sure you're not panicking. Like, there is no need for fear or panic at this moment. Just reduce the chance of this spread for you, for your baby, for your family members, and stay safe. That brings me to the end of this video. Let me know if you have any question. Drop it in the comments down below. If you have any suggestion of topics you would want me to discuss about, drop it in the comment down below. Don't forget to share this with a pregnant mom. She needs to hear this. Share this with a nursing mom. Don't forget to like. Don't forget to comment. Don't forget to subscribe. And I will catch you in the next video. Bye.